Good morning, students. This lesson is of class 10th for the subject of physical education. Topic: Types of sports related injuries, which is covered in chapter 6, titled Safety in Sports of your textbook Health, Physical Education and Sports, AP Publishers, and is being submitted to you on 14th of December 2020. This voice is of Mrs. Kusum. All students may now please open page number 46 of your textbook. If you all are ready, then let us start with types of sports injuries. All of you, please listen carefully as I will be asking a few questions in between the chapter. Types of sports related injuries. Point number 5. Stress fracture. A stress fracture is a small crack in a bone. Usually, stress fractures are caused by overuse and repetitive activity. These fractures are common in high impact sports such as long distance races, basketball, football, etc. Stress fractures may also occur due to changing workout surface, jogging on a treadmill versus jogging outdoors, improper technique, osteoporosis, poor conditioning, etc. Stress fracture occurs in leg bone. Symptoms: Point number 1, swelling. Point number 2, pain in wards with weight bearing. Point number 3, pain generally decreases with rest. Treatment: After stress fractures, the procedure of should be followed, that rest, ice, compression and elevation. Point number 6, fracture. A fracture is a broken bone. In fact, it is a medical condition where continuity of the bone is broken. It can range from a minor crack to complete break. Fractures can occur in any bone in the body. There can be many types of fractures in the bones, such as simple fracture, compound fracture, complicated fractures. Most of the fractures occur when a bone is impacted by more force or pressure than it can support. It may occur due to sudden fall on hard surface, direct hit with. Symptoms of a fracture. A fracture is usually a very severe injury and the athlete will know about it due to the pain, tenderness, bruising and swelling. It replaced fractured. There may be some deformity present depend on the position of the fracture. There may be some restriction of movement. Treatment: If you think that there is a bone fracture, you should provide first aid immediately without wasting any time. The following steps may be taken immediately. Stop any bleeding. If there is any bleeding, stop it immediately Apply pressure to the wound with sterilized bandage or a clean cloth. Immobilize the injured area. If you suspect that there is a fracture, do not try to change the bone. You just immobilize the area using splint or sling. Apply ice packs. Do not apply ice directly to the skin, but wrap a ice pack or bag of ice 10 to 15 minutes at a time. It will be helpful in reducing pain as well as swelling. Treat for a shock. If the injured athlete feels fainting or rapid breaths, lay the individual down with head slightly lower than the other body parts. Also encourage the injured to rest and try to reassure him. Point number 7, plantar fasciitis. It is a common painful foot condition. It is one of the most causes of pain on the bottom of the heel. It involves inflammation of a thick band of tissue that runs across the bottom of the foot and connects the heel bone to toes. It occurs due to obesity, increased activity, very high arc peristis, running, and the shoe with inadequate sport. Symptoms. Point number 1, gradual pain under the heel which may radiate forwards into the foot. Point number 2, pain is usually worse first in the morning because the foot has been in a relaxed position all night and the plantar fascia temporarily shortens. Point number 3, after walking around this usually cases as the tissues warm up and gradually stretch out. Causes. Point number 1, it is an overuse injury caused by repetitive stretching of the plantar fascia, which is thick band of tissue tendon that runs under the foot, leads to possible inflammation and thickening of the tendon. Point number 2, it is more common in sports which involve running, dancing, or jumping, although overuse is ultimately the cause of injury.